Dr. Shannon, I know you do orthodontics work and you do Invisalign, and that's kind of like it now. I want you to talk about Invisalign here and tell us, what the advantages are. I mean, personally, I'm interested. Are those suckers really invisible? So anyway, tell us about Invisalign and
okay.
and for who they are and for who they are not.
Okay. Well, first of all, I'm going to call them invisible braces because Invisalign is a brand name, and there is more than one brand name, although Invisalign does a tremendous amount of advertising, so people think Invisalign as invisible braces, but I'm going to call it invisible braces because they're not paying me money to talk about them, so I'm not going to talk about them as an individual.
Okay,
so,
makes sense.
So invisible braces they're incredible. My personal opinion is they're absolutely incredible. When you put them in your mouth, you cannot see them. The average person, let's say, stands within, I guess, your zone of comfort. The inside zone of comfort is about 18 inches. Anybody who stands closer than 18 inches, you're going to start leaning back because you feel like they're invading your space. At 18 inches or further, they are not visible at all.
Wow.
So when you say invisible braces, you really mean that they're invisible. So that's number one. Number two, they're really for everybody. It just depends on what the individual case is. So there are going to be some people that are outside those parameters. But they'd be outside of those parameters with any type of bracing system as an adult, because there's two types of bone that we have in our mouth. One is a youthful bone that when children are young and the teeth are growing in and the bone is soft and you can move teeth large distances because the bone hasn't set in position yet. As an adult, that bone has set, so you really can't move the teeth quite as far. So if somebody comes in with a very, very severe orthodontic situation as an adult, there's probably not a perfect solution with any type of system of orthodontics or braces out there that would make their teeth perfect.
Okay. So what makes the Invisalign different and better? What are some? Does a patient have to go less to the doctor to the dentist with the Invisalign?
Well,
does it hurt? Like, what advantages are there?
There are a lot of advantages, and I do, as you were saying, I do the invisible braces, and it's nice to see the advantages of those because I started doing braces on patients 25 years ago when we started with the metal. The old style metal wraparound bands on people's teeth. So they've come a long way. The advantage of it, the first most important advantage to me is because mostly we're having adults using them who want to straighten their teeth later in life that didn't get a chance earlier on, or maybe they had braces and things relapsed and they got crooked again because they didn't wear their retainers or something, So the adult comes in, we have to be concerned with their gums and their general health in their mouth as relating to their heart and all these other things with bacteria there. You take these out when you're eating, which is nice. So you can eat anything you want because you're not wearing braces when you're eating. So if you want to have something that's gooey and sticky and messy or corn on the cob or something, you can do that. It's not a problem. And then you go in and you floss and brush your teeth.
No spinach, being hanging there,
right, nothing hanging off the vines, right?
Waving like the Mexican flag at you, huh?
Right, exactly. So, the nice thing is you can floss and clean your teeth and brush them nicely and then put them back in. There's really no other reason to take them out except when you're eating. Now, you can also take them out at other times. As I said earlier, at about 18 inches away, when you're in that zone of privacy, you feel like you're being, leaned into. If you're in a situation where you're on a date with somebody, and you want to be closer than 18 inches, and you're conscious of the fact that you have these in your mouth, and you don't want that person to know that you have them in your mouth, then you can take them out for a couple of hours and take a break from your braces. Leave them at home. And then you can always put them in later on. So, you have those options. If there's a psychological feeling that you need to have about it, you're in control of that.
Right. So, that sounds like a big advantage. If and when a person at the beginning, he might still be conscious about, can I see it? And he has that first date, that first important job interview. So what? Take him out. You know what I'm saying?
Right.
Till you get used to it. So, but one thing you mentioned, when people have braces on it, obviously it is very difficult, not impossible, but difficult to floss and brush your teeth. And
right.
That in itself can possibly lead to gum disease. And we talked a lot about how devastating gum disease is, even the slightest one. And with the invisible braces, that kind of falls away because you take them out, you brush them normally, and you put them back in, right?
Exactly.
Beautiful.
Plus, it's stressful for the person. I have adult friends who have worn braces, and they say, it's so hard to keep them clean that they actually wind up, I guess it's a good way of losing weight, they wind up losing weight because they don't want to eat as much as they've lost the interest because it's been depressing, So it's why I like to call that the dental diet. So if you're in need of a dental diet, you might want to have braces, but for 95% of us that don't want to miss a meal because of depression of their dirty teeth or whatever, then Invisalign, or invisible braces rather, invisible braces is the way to go.
Right. Okay. But you talked a lot about adults. I mean, are they nevertheless good for young teenagers also?
There's a certain stage if all of the permanent teeth are in the mouth. Sometimes with orthodontics, there's so much structural change has to be done. You wind up starting braces when children still have baby teeth. And when that happens, you cannot use invisible braces with them because invisible braces, they use a foundation that's not going to be changing.
Okay. And also, I guess the child would take him out, lose them, throw him away, step on it, play ball with it, or whatever, right?
That whole maturity issue, sure.
Right, but by
16 years of age, a lot of times kids want to wait, or parents want to wait, or they put it off for a little while. Then all of a sudden their daughter's 16, and she's saying, I want to have straight teeth for my high school graduation pictures next year, and they go like, oh my God, I have a year, I better do something. At 16 years of age, you can certainly put those invisible braces in and get teeth. Most teeth can be straightened in that period of time. And if they're not perfectly straight, again, the pictures could be taken. And I've had this happen with patients, take out the Invisalign for the close-up pictures, for the graduation pictures. The teeth aren't 100% perfect yet because the case isn't finished yet. The teeth aren't done yet. But they look tremendously, incredibly better than where it was if they would have waited till they graduated high school to start the braces. So you have that as an option too, which is nice.
Right. Wonderful. And what about visits to the dentist? Is that slightly diminished with the braces?
Oh, it's tremendously diminished. Tremendously. First of all, there's no emergency stuff. I mean, as many times as you tell somebody, be careful of this, be careful of that, they will pop off or break off one of those brackets, those metal brackets from the standard type of braces. And they have to call and make an appointment, and the dentist has to find a time and has to be good, and they make these, and they have to come in once a month to get rubber bands changed, or else they start to look like, as you were saying, the spinach hanging from the flagpole and everything, So now when you come in, usually we're looking at once a month, every 4 to 6 weeks only, and it's usually a very short visit because we're just changing trays. Because, invisible braces is a series of trays where each tray moves the tooth a little tiny bit, and then after 2 weeks you put another tray in. So we give 4 trays at a time or 3 trays at a time, depending on the case, and it's every 2 weeks. So patient comes back every 6 or 8 weeks. We look at it, we check it. We may have to do a little bit of some stuff going on as a dentist would do, a short 15, 20-minute visit, and then they get a new set of trays to move on, for the next, 6 or 8 weeks. So it works out great with a work schedule for, when someone's working at a job, they don't have to worry about running to the dentist all the time.
And if a child breaks the tray for whatever reason, that can be redone?
Yeah, we have the, it's all, again, we didn't really talk about what invisible braces are, but it's all done by computer. So we just contact the lab that makes these, and we tell them tray number 7's been lost, and then, a week later, there's a new tray number 7. In the meanwhile, the person goes back into tray number 6 that they've already worn because they have that tray, and they put that back in their mouth, and that holds it in position. Whereas if they were wearing braces and they broke one of those brackets off the tooth, all their teeth are going to be moving until they go to the dentist. That one tooth isn't going to move anywhere. That's going to cause bigger problems, going to make it a longer case. How many people do you know that went in for braces and were told, well, this will take about 18 months. And 3 years later, they're still in braces. Why are they still in braces 3 years later? Well, probably because they were breaking off brackets and weren't going to the dentist to get things changed on time and everything. This takes that whole area and just eliminates it. That's not a problem any longer. It's just boom. The case just moves along. As long as you wear your retainer or the aligner, as long as you wear that, that's it. The case will be done when it's supposed to be, and the computer tells you when it'll be done.
Right.
So there's no guesswork.
It's amazing. So it's nice to see that technology, whatever that means to all of us, hasn't bypassed dentistry.
Nope. Dentistry's in the heart of it. And the interesting thing is, to do it this way, you think with all those conveniences, you have something you can charge more for. It's the same cost as the aggravating, uncomfortable, gum-cutting, lip-sore, food-controlling, messy braces that everybody's worn for all these years. It's no additional money. And that's nice.
But you do not lose weight because you keep eating normally.
Right, and that's the fun part. You can buy 2 sets of clothes.
All right. Bye, Dr. Shannon.
Bye.